Thanks so much for tuning in and joining us today. My name is Dr. Nisha Jalani. I'm a cardiologist at Columbia University Irving Medical Center and also the director of the Women's Heart Health Initiative for the Cardiovascular Research Foundation. Over the years, we've been thrilled to bring you these mini med school seminars that share important information for not only women, but the general public to be empowered about their health care. We had a seminar planned for this past April, and obviously it had to be delayed due to COVID. So we're bringing it to you for the first time via webinar. And so thank you for joining us online. The title of our program is Get Heart Smart, and we wanted to focus on when to seek medical attention even during a pandemic. What's been happening over the past several months is obviously a lot of people feel, some symptoms and they're not sure if it's significant enough to warrant going into the hospital or going into the doctor's office. And so we wanted to alleviate some of those concerns. I'm very happy and excited to be working with Dr. Ajay Kirtane, who is an interventional cardiologist at Columbia University Medical Center as well. And he is the director of the cath lab for New York Presbyterian Columbia University Medical Center. Ajay has also always been a very strong supporter of the Women's Heart Health Initiative and has been a great advocate for women's health all around. So thanks so much, Dr. Kirtane, for joining us.
Thanks for having me.
So why don't we get started? Dr. Kirtane, if you could just tell us what cardiac care has been going through over the past several months in the setting of the COVID-19 pandemic. What are your thoughts?
Well, I think first, thanks so much for having me on this program. It's really important to get this type of medical education, especially during a pandemic, because so many people are staying home. And first, I also want to thank everybody who has been staying home, because it's allowed us to be able to do our jobs here in the hospital, taking care of some of these sick patients. But what's been really interesting, and it started to be observed in China, then Italy, and then throughout the world, actually, was that overall the heart attacks kind of went away. There were less hospitalizations for heart attacks, not just heart attack, but heart failure, arrhythmias. Basically everybody with cardiac complaints seemed to stay away from the hospital. Now, many people think that this may be just because people are afraid to come in because of being exposed to COVID, and that's certainly part of it. But also there may be some fascinating evidence that because people are staying home, they're less exposed to carcinogens. They're not doing the crazy things that they might normally do when they're running around. And so there may be truly a decreased incidence in these types of events, more so than just people avoiding coming to the hospital. But nonetheless, we know that people are still having these events, and we don't want folks to actually have an event that we could otherwise treat when we weren't in a pandemic, sort of people just ride it out at home and not get the care that they could sort of be delivered. And so that's one of the reasons why I think, Dr. Jalani put the era of telemedicine was born, because there are many ways to reach your physicians, and this can often be done through telemedicine. We tried to kind of do this before the pandemic, but it really started booming more in this setting because we really didn't want people coming here unnecessarily. Those that needed to be taken care of certainly could come, but the others, we actually did a lot of visits, and some very interesting things and observations you can see when you look around a patient's home. I had one patient last week who had kept telling me about his home renovations that he was doing. I never could picture it. He would sometimes show me pictures on his phone. When I did a telemedicine visit, he actually gave me a tour of his house. So I think some of these things were pretty cool going on.
Yeah.
But the point of this was actually to talk about what should prompt urgent medical attention. What signs and symptoms should you be aware of, or your family members be aware of, that would actually prompt reaching out to a physician or coming to a hospital?
Yeah, that's exactly right. And I feel like a lot of times, either via telemedicine or just even when you're talking to friends and family, a lot of people have chronic conditions and then may have either new or sort of these subtle symptoms that that otherwise would seem alarming and would maybe bring them into the doctor's office. And so we wanted to touch on some of the common cardiac symptoms. Sometimes these symptoms can be completely benign, but other times they can signify something that's urgent and sort of needs more prompt medical attention. So we wanted to touch on just a few of these, including chest pain, shortness of breath, palpitations, dizziness, and leg swelling. Some of these symptoms can tie in together if there is an underlying cardiac condition. We wanted to break these down one by one and look over what could signify a problem that may need to bring somebody into the doctor's office or into the hospital sooner. So Dr. Kirtane, since chest pain is sort of your bread and butter, I figured you could take us through when should patients worry if they're feeling chest pain. I mean, this is obviously something that most people hear this phrase and think that they need to go to the hospital. So what do you think?
Yeah, and I think it's important to go over it again, because also some of these symptoms can overlap with COVID symptoms too. And so many people are being told, stay home if you have COVID. But if you have chest pain, pressure, indigestion type symptoms, those types of things, especially if it's new, if it's worsening, if there are other symptoms, for instance, when you walk around, it gets worse. If you sit down, it gets better. That's suggestive of a blockage in the heart artery, and that's something that really needs to seek immediate medical attention. If it's not going away and it's just happening at rest, that's a 911 call. That's not something where you wait and you look up your doctor's number and you wait for them to call you back. No, that's a 911 call. If it's something where it goes away and it only comes on with exertion and that's new, then that's something that you should call your doctor about, because it could mean a blockage in a heart artery. And with blockages in heart arteries, there's more difficulty for oxygen to get to the heart muscle, which is why that sensation actually comes about.
Yeah, that's right. So just like Dr. Kurtene just touched at, we don't want to underscore, we don't want to pacify the urgency of certain conditions. So if there's something that, if somebody feels like they're having a heart attack, and usually, even if it's not chest pain or pressure, would you agree in saying that most patients, when they're having a heart attack, even if it's something other than chest pain, they know to call 911. They know that it's something that's happening, that's different, that's urgent, that kind of, really it has a sense of urgency to it.
I think so. Although I will say, it depends on who it is. I'll say that the spouses generally seem to know what to do, and the stoic, stubborn dudes that are often my patients don't, and they blow it off and they say it's indigestion or I'm going to go lie down. And I think, Nisha, you've seen this many times as well. So if you have a family member that's having these symptoms, you got to take it seriously for sure.
Right. And if it's something that's, coming about more subacutely or more exertional, goes away by itself, it doesn't last too long, those kinds of things, that it is something that you should make a doctor's appointment in the next couple of weeks. It's not something that you should ignore for too long. And then there may be other medications and testing that your doctor may do. Do you want to talk about some of those, Dr. Kurtene?
Yeah, I think most of them involve coming into the hospital. One thing I do want to reassure people, though, about is that now that we've sort of been through the early phases of the pandemic, if people come to the hospital, there are clear protocols for separating patients out, making sure that you're not exposed to other patients who might have COVID. So all those things have been done now, so it is safe to come in. And some of these tests involve looking to see if there are blockages of the heart arteries. And one way of doing it is through a CAT scan. Another way of doing it is through an invasive procedure called an angiogram or a catheterization that typically involves just putting a small needle in the wrist or in the leg that then allows us to take pictures of the heart arteries. And if there's a blockage, we can then actually open the blockage, relieve the obstruction to flow, restore oxygen supply to the heart muscle, and therefore alleviate the pain.
That's right. And that's what Dr. Kurtene does all day long. So another symptom that a lot of people have, and again, this is there's a spectrum of how severe shortness of breath can be. But shortness of breath, when should somebody worry when they're having shortness of breath? If you feel like you need to stop walking or stop climbing stairs that's suddenly out of proportion to your baseline, meaning, if you're somebody that can climb up 2 flights of stairs, and then you sort of huff and puff at the top of them, but you could get to the top, and now all of a sudden you can climb up only half a flight of stairs, and then you have to stop to huff and puff. That's a big change. That's a big difference. So if there's something that's a sudden change from your baseline, then that's something to prompt further thinking. Also, associated symptoms. So when we think about, are you getting short of breath more quickly than usual? Are you also having water retention elsewhere? So do you have swelling in your legs? Do you have trouble sleeping at night? So people who are having sort of pulmonary edema or a buildup of fluid in their lungs due to some weakening of their heart muscle, people can often wake up at night gasping for air and needing to prop themselves up on more and more pillows. So these are all signs that should prompt you to call your doctor and make an appointment, again, in a timely fashion. If it's shortness of breath, if people are describing shortness of breath or feeling sort of winded, especially in the hot summer months, you maybe gained the COVID-15, that kind of thing. Those are the sort of symptoms that it's just more of a subtle thing that could be from just deconditioning. But if you have any of these sort of signs, that would be something that could point to a cardiac condition. And what this could mean is something called congestive heart failure, which could mean either that the heart pump function is weakened and therefore water or blood can sort of back up into the lungs. It could also mean that the heart is just stiff, and that's a reason for the backup into the lungs, or it could signify some sort of valve disease. And this is a significant issue, especially in our elderly patients. One specific form of valve disease known as aortic stenosis, which I'm going to have Dr. Courtenay talk to us about, because that's something that needs to be acted on, again, in a timely manner, because there just simply is no medical therapy to alleviate the symptoms of that. The next steps in any of these, so if somebody is feeling shortness of breath that could be suggestive of any of these conditions, the next step again is going to see your doctor and getting an echocardiogram as the first line test, which is an ultrasound of the heart. Cardiologists love this test. It's our bread and butter test because there's no radiation, there's no contrast. It's a very safe and reliable test. And it gives us a lot of information about the heart function, the valve function, the pressures. And so this is sort of our first line test in working up heart failure or valve disease. And so aortic stenosis is a significant problem. And Dr. Courtenay, why don't you tell us about all the exciting new therapies that we have?
No, absolutely. First of all, I take offense because you already said before that people would gain their COVID-15, and that may be you for your body habit. As I certainly gained more than 20, and then I had to try to lose it. So anyway, but looking at aortic stenosis and heart valves, people often ask, why does the heart have valves? And the reason is the heart is a pump, but the blood only will flow in whatever direction it's directed in. And so the valve prevents blood from flowing in the wrong direction. And the four heart valves, the two that are sort of most commonly involved and have problems are the aortic valve and the mitral valve. And we'll talk mainly about the aortic valve, but basically on the right of the slide, you can see what it looks like when it's open, and that allows blood to flow forward out of the heart and into the aorta. But when that valve over time and with aging and with calcium and other things that can happen gets what we call stenotic or closed, it gets constricted. And that puts a lot more strain on the heart because the heart has to try to pump the same amount of blood, but it's pumping it through a restricted opening, a constricted opening, and so therefore it has to squeeze a lot harder. And as a result, that leads to shortness of breath, chest discomfort, and even dizziness or lightheadedness when it's so severe that there can't be enough blood flow going forward into the brain. And so this is something that, especially as patients get older, you have to be cognizant of. And all of the symptoms that Dr. Jelani described of breathing issues, couldn't breathe at night, more exertional shortness of breath, can be a sign that you might have a problem with your heart valve, and that can be easily diagnosed by the echocardiogram, which is basically just an ultrasound put on the surface of the chest. Now, the other thing about aortic stenosis is that if you have it and it's severe, traditionally it was treated with an open heart surgery. So they'd cut open the chest and they'd fix the valve and put a new valve in. But some of the catheter-based innovations that have actually been led through the Cardiovascular Research Foundation, physicians, and the foundation as a whole, are the ability to do this with a minimally invasive approach. Just a big needle that gets put in the leg, and the valve is actually a new valve is put inside the old valve, and that's called the TAVR procedure. So this is a type of procedure that can be done less invasively, avoiding an open heart surgery for patients with severe aortic stenosis.
That's right. And especially because we know once it's symptomatic and severe aortic stenosis, there is no medical therapy. And so really to keep patients out of the hospital and to keep them from, to improve their overall mortality, morbidity, everything, seeing a doctor and getting scheduled for a TAVR in a timely manner is really important. This is not something that we want to ignore in patients, even during a pandemic. So another symptom that I've had a lot of patients call about, and this again is on a spectrum, but palpitations, so extra heartbeats, fast heartbeats. Palpitations is one of those words in medicine that could mean so many different things depending on the person that's using it. So it could mean that somebody feels a couple extra beats. It could also mean that somebody feels their heart is racing or that it's very irregular. So when to worry, usually it's when it's very frequent, meaning it's very symptomatic for you, even if it's just a racing heart but with no other associated symptoms. But if it's something that's bothersome enough and happening frequently enough throughout the day, then that's something to get worked up further. If it's associated with lightheadedness, chest pain, or shortness of breath, that's definitely something that you want to either go into the emergency room or go into your doctor's office to get an EKG done. If you pass out, for sure, you should go and see, go to the emergency room. And if it feels very irregular, so if you check your pulse in your wrist, some patients do that, and it feels very irregular, that could signify something called atrial fibrillation, which we'll talk about in a second. That's kind of this EKG strip where, you know, the beats are coming very irregularly. And that could be something, depending on the heart rate, that could be very symptomatic to people, or it could be completely asymptomatic. So an EKG really gives us a lot of information when somebody is complaining of palpitations. Other patients have sort of very mild symptoms, palpitations or racing heartbeats that happen every few days or every few weeks, and then go away by themselves after a few seconds. That's actually more common than we think. That's the kind of thing that if it goes away by itself, it lasts a few seconds, you don't get dizzy. Sometimes patients can even try to hold their breath and bear down. So, you know, kind of like pushing down while holding your breath. That if that breaks sort of the cycle of fast heartbeats, then that's usually something that's more benign, but again, should be checked out when it's safe to. So like I said, it could signify just extra heartbeats, which are usually not a problem if by themselves, or it could signify some sort of other arrhythmia, and some are more dangerous than others. So the next steps, usually an EKG is the very first thing that we would do, just to see if there, especially if it's during the palpitations, if there's no, you know, if there's no arrhythmia that's happening at the time of the EKG because somebody's not feeling them at the time, then we can set up either a Holter monitor or a 2-week event monitor, depending on how frequently the palpitations are happening. A Holter monitor is usually 24 hours. So if you're getting symptoms every day, that may be enough. If it's happening every few days, then we would need something more like 1 or 2 weeks. And these are done pretty easily. I will say, in the setting of COVID, we've actually had patients who didn't want to come in, or we couldn't bring them in because it wasn't safe to bring them in. We're having palpitations that we wanted to diagnose, and our office was actually able to mail them a monitor that they could put on themselves at home with instructions, and then could mail into the company when they were done wearing it. So I think technology is a great thing, and we've been using it more and more during this pandemic. And then depending on what the Holter monitor, what the EKG, and, you know, other risk factors for people, an echocardiogram, like we talked about before, may also be done. So what I mentioned earlier about atrial fibrillation is a very common arrhythmia. It's an irregular heart rhythm where basically the top chambers of the heart, the 2 atria, beat very fast and very irregularly. Sometimes it's not as fast that it is asymptomatic, but sometimes it goes so fast that people get lightheaded, people can get short of breath. It can cause, again, you know, buildup of fluid in the lungs. So there's again, a spectrum of the presentation for atrial fibrillation as well. The reason why it's important to diagnose is that because the atria are sort of beating erratically, there's a lot of stagnant blood flow, and that can predispose somebody to having a stroke. Again, this is a yearly risk of stroke, even if in people with high risk. But for that to alleviate that risk of stroke, we place patients on blood thinners as long as there's not a contraindication. There's a lot of blood thinners out there, but I did want to mention some of them because these are blood thinners that can be used for several different conditions. But warfarin is the oldest one. It's warfarin or Coumadin. That's the one that can be affected by what you eat. It also requires more frequent blood draws to make sure that the level is appropriate. There's also the newer agents, which are dabigatran, rivaroxaban, apixaban, and edoxaban. So I did want to mention all of those. Those don't require as frequent of lab draws. It's the same dose, you know, depending on a person's weight and kidney function and things like that. But they're a little bit easier to use. So I did want to mention these drugs and the reason why it's important to diagnose atrial fibrillation in people with other risk factors. So Dr. Courtney, do you want to talk to us about dizziness? That's something else that people talked about before, but then also since COVID, I've been seeing a lot of people who complain about dizziness.
Yeah, I think, you know, some of the newer data that shows that for those that have had COVID, up to 1/3 of patients will have residual symptoms afterwards. This is definitely something we see. Dizziness is also to be differentiated from two kinds. One is sort of lightheadedness, where you get up and you feel woozy. And then another type is when you really feel spinning. And typically, the cardiac version is not the spinning. The spinning is usually something either of the inner ear or something in the brain, or often associated with certain viruses, not necessarily COVID. The lightheadedness thing, though, it could be a cardiac problem. It can be an arrhythmia, as you mentioned. It could also be a valve problem, or just dehydration. It's like 95 degrees outside right now in New York, and if you don't keep up with your fluids, then you're going to feel that way. The times when it's sort of less worrisome are if it happens when you stand up too fast. Let's say you're squatting or you bend down to pick something up, you stand up, you feel lightheaded. That generally is this issue of either dehydration or relative dehydration. It's sometimes, by the way, exacerbated by medications that patients are already on. So if you're on blood pressure medicines, it can be even worse in those times. And then also, if you're sort of having a viral illness at the time and you feel a little bit lightheaded or you feel some spinning, that generally is a little bit more benign. It's not as indicative of a severe cardiac condition. The only caveat to that, though, is that with COVID in particular, there are increased incidences of blood clotting, and dizziness can be a sign of a blood clot that happens too, especially if you're very, very lightheaded. So something for certain to keep tabs on and to contact your physician if you start experiencing it, especially if it doesn't go away. When you have dizziness, what you would do in terms of the workup, there are basic tests like the echocardiogram, a monitor to see if there's an arrhythmia, and then sometimes you'll get an ultrasound of the neck. And this is an image of an MRI, but the ultrasound gives similar information as well to look at the carotid arteries, because you can always have cardiac disease that causes these things as well.
Yeah, that's right. I think the key point that you brought up, Dr. Courtenay, is that vertigo versus lightheadedness. So, the viral illness, the room spinning, that happens for a while, especially in the setting of having some sort of viral illness. People take medications for vertigo and that gets better. Those medications would not help if there was some sort of limitation to blood flow to the brain because of either a cardiac or a vascular issue. And so the final symptom that we wanted to talk about was leg swelling. So this is, again, something that happens a lot in the heat and associated with certain types of foods that we eat. But the times when somebody should worry about leg swelling is if it's associated with shortness of breath as well, because again, this could signify a valve condition, an arrhythmia, congestive heart failure, one of those things that leads to a cardiac condition or signifies a cardiac condition. So that would be something that should prompt an echocardiogram and other testing by a doctor. If it's unilateral, meaning it's only happening in one leg, especially if that leg is painful, or if there was an associated trauma or something like that with that leg, and we'll talk about what that could mean. But if it's on one side and it's new, then that's something that should be worked up with an ultrasound. Or if it's associated with overlying redness or pain. The reason I wanted to mention that is because cellulitis of the legs, which usually is one side or the other as well, but cellulitis can be a problem for people, and that usually is associated with pain and sort of this redness that appears over the skin, and that needs antibiotics. So it's something that's not necessarily related to a cardiac condition, but is something that should require, that should prompt some treatment. That's something that actually, if you did a telemedicine visit with your primary care doctor, I've had a lot of people show me their lower extremity edema with telehealth. They just, take the phone and they show me their legs, and I have them push on their legs to see how far in the edema goes. But this is something, cellulitis could also be diagnosed by telemedicine. So it's just something that you want to reach out to your doctor, and whether that brings you into the office or not depends on what what they're thinking you have. When not to worry as much, again, is when it's, like Dr. Courtenay said, it's 95 degrees out, you just had a bag of chips, and you've been on your feet all day long, and you have some pedal edema or some foot swelling at the end of the day, and then it goes away with elevating your legs. That usually signifies a problem with the veins in the legs, that basically the veins are getting a little bit leaky and are getting overloaded. And so throughout the course of the day, you just sort of have some swelling that happens in the legs, and then when you elevate them at night, that resolves. So that's usually something that's more reassuring. This is a picture of pitting edema that's usually associated with some cardiac condition like congestive heart failure. But for that reason, so if there's something like this that's pitting edema on both sides, an echocardiogram seems like it would be the best next step to make sure that the heart's okay. And then if it's more unilateral and you're thinking about a blood clot or something like that, a lower extremity ultrasound would be warranted. And as Dr. Courtenay had mentioned, blood clots have been seen in the setting of COVID because it just makes you more prone to clotting. So a DVT, which I'm not sure if people hear about this phrase, but DVTs and PEs are basically blood clots in the legs that then travel to the lungs to lead to a pulmonary embolus.
Think Serena Williams, what Serena Williams had, that's what this is.
Exactly, right. So a blood clot in the deep veins that are usually in the legs. and can potentially travel to the lungs and cause a pulmonary embolus. So risk factors for that are prolonged immobility, so recent trauma or surgery, being in bed for prolonged periods of time, pregnancy just because it's a hypercoagulable state as well, and then people who are genetically prone to clotting. So if you've had multiple family members who've had blood clots, then this could mean or signify some underlying hereditary risk. And then I should have put on this list also having COVID, because COVID has been seen to increase the risk of DVTs and PEs in people.
So we kind of want to just conclude by taking you through some basic symptoms that you might have or family members might have, and knowing that you can get medical care for these. Some of these medical cares can be administered remotely. As Dr. Jelani said, you can actually incredibly do parts of the exam that you never thought you could. We're looking at someone's legs because they bring the phone down. Unfortunately, sometimes it's hard to coordinate. I had patients drop the phone, but that's okay. We're patient, we'll wait, and we can see what goes on. This phrase "different matters" is really if you feel different from your normal self, and admittedly there's a range of this because there's so many emotions that go through being in the pandemic, et cetera. But if you feel different from your body standpoint, that's something to really pay attention to, and not only mention to your family members, but possibly reach out to your doctor, especially if it doesn't go away and it's getting worse and it's any of the things that we talked about. In an emergency, if something is really severe, call 911. It's just the safest thing to do, and legitimately now, irrespective of where you are, whether there's an outbreak occurring or not, your EMS units are equipped to deal with these types of things, and even just coming on site and doing an EKG may be the difference that saves your life. So it's important to do that, and it will get you expeditiously to the hospital. Certainly on the physician side, I think many patients I've been touched have been caring for us. Like I talk to patients, they're like, "How are you doing? Are you okay? Things are okay in the hospital." But it's a two-way street. We often worry about our patients, and so especially in a pandemic, because we're not seeing them as regularly. So we do want you to reach out and ask us questions, if you have concerns. And offices now mostly are either open or they have answering service arrangements or ways that people can get in touch either through telemedicine and or other mechanisms. So for sure do that. We do think telemedicine is our friend. It's made things pretty convenient for a lot of patients. For everything, it's not the answer though. There's some people who need to come in, but what it allows is for offices to be more socially distanced so that you can limit the number of people who actually have to be on site. So your physicians and your family members all feel safer when they actually come in. Finally, I don't have to tell people, but wearing a mask, socially distancing, and washing your hands are so critically important for this pandemic in particular. But for those that have cardiac conditions, remember you're at higher risk for having adverse events if you were to get COVID. And so therefore, all these things are really important, not just to keep you safe, but to keep you from transmitting it to other people as well. So we will get through this together. It's still going to take some more time. But the idea behind this was to sort of let people know not just about COVID, but all the other conditions that are really important. Dr. Jelani, you should wrap this up because I just thank you for allowing me to be on this program. It's fun taking care of patients with you every day, so it's certainly fun interacting in this way as well.
Absolutely. I wholeheartedly agree. So thank you so much for joining us. It's been great to get your insight into these things. And, just to ditto what Dr. Courtenay just said, we really do want patients to feel comfortable reaching out to their doctors. And I'm sure all of your doctors feel the same way, that, you shouldn't sit at home worrying about any symptoms that you're having, worrying about any concerns that you have without reaching out because you think that the healthcare system is still overwhelmed. I mean, even if it is, your symptoms matter. And I think we don't want to build a culture where we want to ignore symptoms or patients. So hopefully this has shed some light and given you some clarity. And we're happy to be able to help in this way. And hopefully our next mini med school can be in person. But if not, thank you again for joining us. All right, take care. Bye-bye.